Thank you everyone for joining us today. Welcome to Friends of the Sarawak General Hospital Kuching, the Society for Cancer Advocacy and Awareness Kuching, in short from SCAN, UNIMAS Academic Staff Association members, as well as UNIMAS staff who have joined us today. Thank you for joining us out of your busy times. I know it's 2 weeks more to exam week and a lot of lecturers and staff are actually quite busy, but the video will also be taped today and will be available on a YouTube channel hosted online, and I'll just get into it. It's a very informal sharing session with the Society for Cancer Advocacy and Awareness Kuching. Firstly, before we start, I'd like to thank the organizers co-hosting with us the Gamification Center in UNIMAS. They've kindly agreed to allow us to use the facilities today. And welcome to our esteemed speaker, Dr. Adibah Ali, who you will hear more from after this. So just a little brief introduction to PPAU. Can we have the next slide? Thanks. So we were invited to collaborate with SCAN and the Department of Surgery, SGH, to kick off for the start of 2021, a session that touches on the well-being of our staff. And this is quite an important session because this is quite close to our hearts. In UNIMAS, we have lost academics over the past few years to breast cancer specifically, as well as to other types of cancers, which could have been prevented if early prevention and early detection was done. So let us take a moment just to remember them in our prayer. All right, thank you. And then I'll quickly introduce a little bit about UNIMAS. In UNIMAS, we have over 800 staff, and over half are represented by PPAU or Persatuan Pegawai Akademik UNIMAS, or a UNIMAS Academic Staff Association. And so we are quite a strong community of academics. And the priority for the association is to advance and protect the rights and welfare of our academic staff. So just a brief outline for the agenda for the talk today. Dr. Adibah will share with you her session, and then we will have a Q&A moderated by Associate Professor Dr. Fitri. And then SCAN will introduce some of the vital work that they have been doing besides what you've seen in the video shared earlier. There's also a little bit of housekeeping. For those who attended today, you can get an e-certificate if you would like. Just answer the very short Google form that's provided in the link in the chat group, or you can just scan it on your phone as well. And then when you register your attendance for this, yes, as you can see the code there, you can scan it, or you can type into your browser and register there. And you will get a certificate of participation in your email. All right, so thanks very much. So very quickly, and we'll move on to why we are here today. Our speaker and expert in the field is Dr. Adibah Ali. She's a consultant for breast and endocrine surgery at Sarawak General Hospital in Kuching. So she's a UNIMAS alumni, and I'm proud to say she's also from the school that I came from before, a girls' school, but I'm not going to mention it in case some people say I'm blowing our own school trumpet. But she's also actively involved in a lot of academic work. She's hosting and intern a lot of UNIMAS medic students with her. She's also involved in a lot of research and has presented on the national and international level in her field. So we are very fortunate to have such an expert to find time to speak to us today. She's passionate about the work she's involved with, especially for breast cancer awareness and working with the local communities. She champions and advocates for the NGO, the non-profit organization SCAN, and she's the resident medical advisor to them, and she continues to support groups and people in need. So we are really proud to have her speak with us today. especially about the incidences and prevalence among women in Sarawak for breast cancer specifically. Thank you. The floor is yours. We're so happy to have you here today.
Okay, thank you, Mr. Zani. First of all, I'd like to thank to SCAN and PPAU, UNIMAS, to collaborate with us so that we can continue to give awareness to the public, because as we know that every month of the year, especially in October, we do have yearly event, but I think because of the COVID pandemic situation right now, we can't have that. So that's why I was giving the idea to them if we can have this public talk so that everyone's still aware about how important knowledge about the breast cancer. Okay, I'd like to start my talk about the breast cancer. What do you really need to know? Okay, breast cancer is a very common disease. It's about 1 in 8 women in United States. About 12% will develop breast cancer over the course of her lifetime. In Malaysia, reported about 1 in 29 women had breast cancer. Even though the numbers is 29, but it doesn't mean that it is rare compared to United States. It's just because of we still have underreported data of breast cancer. Okay, this is the data that we got from Oncology Unit SGH. We can see that the list of 10 cancers, top 10 cancers, breast cancer is still the most top in the list. If you can see, about 398 patients newly diagnosed of breast cancer presented to Oncology Unit in Sarawak General Hospital. What about our clinic? That Oncology Unit, it represents almost patients in Sarawak, because they receive referral from district hospitals and the private hospitals. But in our Sarawak General Hospital itself, in our breast clinic, we have received new referrals of breast cancer, about 191 patients in 2009. As you can see the graph, most of the patients are stage 3 and stage 4, which almost half of the breast cancer patients. Stage 1, it's only consists of 17%. So this is reverse to the data that from developed country. In developed country, the stage 1 is most, about 40%. So this is the data that we are quite worried about, because most of the patients that presented to us are stage 3 and stage 4. Of course, you can see the highest is stage 2, but we try to reduce the number of stage 3 and stage 4. Okay, so the most common age presentation of patient presented with breast cancer are 40 to 60 years old, but we still see patients less than 40 years old. So we have patients as young as 18 years old. Okay, what do they usually presented? Okay, they present to us mainly complaint of breast and axillary lump. Okay, I'll mix with some of Malay words, yeah. So ada ketulan on the breast. Okay, nipple discharge with cecair from the puting, breast pain, usually they will complain of the breast pain, and color or skin changes. So these are the examples of the signs that they presented. Okay, lumps, nipple discharge, dimpling, maksudnya ada macam dimpling on the breast, and then breast or nipple pain, retraction atau inversion, redness, okay, color or skin changes lah, anything on the breast that any changes, that's what they usually complain of. And then the other thing is the lymph node changes, ada ketulan dekat bawah ketiak, and then the swelling itself. Okay, before we go further, the thing that we want just briefly for you to understand of the breast punya anatomy. If you can see, the breast, they consist of one big multiple lobules that connected to the nipple by duct. Okay, if let's say the cells is just consist in the duct, this is considered ductal carcinoma in situ, means that it's still early. It has not breached the duct itself. So if it has invaded this duct, that's what we call invasive cancer, means that it's already diagnosed as cancer. So most people ask me, why did they get the breast cancer? Is it because of family history of breast cancer? So there are list of patient, the risk factors that causes cancer. It's not about, tapi doesn't mean that if you have the risk, definitely you'll get the cancer. It doesn't mean that if you don't have this risk, you won't get the cancer. These are considered only the risk, but okay, for example, let's say you have first full-term pregnancy more than 30 years old, usage of oral contraceptive pills and hormone replacement therapy, any exposure, prolonged estrogen, okay, that cause risk of breast cancer. Okay, medium risk, maksudnya patient having menarche, having menses, early menses as less than 12 years old and menopause more than 55 years old, means that they have estrogen exposure longer than the usual. Okay, this is the risk, dense breast. And the other thing is the higher risk is those have a family history of breast cancer, or they have the genetic family history like BRCA, okay, and then previous chest radiation. So these are the risks, but it doesn't mean that if you don't have the risk, you won't have the breast cancer, okay? So just for overall, it is important to know that what I usually advise the patient, they still have to know subtype of breast cancer, okay? Because they will ask us, why do we need the hormonal status for the biopsy? So we can divide of the breast cancer with different type of breast cancer, because this will help us to decide whether you want the upfront surgery or you nak chemo dulu, whether which. So basically the breast cancer, it can be divided into hormone positive or hormone negative, okay, whether dia ER PR positive atau ER PR negative or HER2 positive. So if you can see the light blue color, okay, ER PR positive, it's the patient that is suitable for upfront surgery. Maksudnya we will choose the surgery first, then chemotherapy. So while for those patients who have HER2 positive and all negative hormonal status, usually we suggest patient for the chemo first. Okay, I will just brief through about this. So what do we do when the patient comes to you? Okay, we call it as a triple assessment. Okay, first, we will do clinical examination. We will take the history of the patient. How long have you been having the lump, the symptoms? Then we do examination. We will palpate your breast. Okay, and then we'll just can determine whether your lump is suspicious or not. Then we will get the imaging for mammogram and ultrasound. Now, last time they said only mammogram for more than 40 years old, but currently now we wanted to have higher sensitivity so that imaging will be more accurate. So it's standard practice now, we will do mammogram and ultrasound for patients who are more than 40 years old. But less than 40 years old, we will just do ultrasound. Then after that, when patient comes to you, after mammogram ultrasound, if suspicious, maksudnya it looks like characteristic of cancer, then we will ask them to get the biopsy. Okay, but if we cannot palpate the biopsy, the lump, then we will ask for ultrasound imaging guided biopsy. Okay, so these are example that, examination by a doctor. Then this is the ultrasound where we use the probe to locate and determine the lesions. Okay, and we combine with the mammogram. Okay, we will perform MRI if we want to have a further detailed information about the lump. Okay, so usually we use this TrueCut needle. Okay, it looks big though, tapi don't worry, we will usually we will give ubat kebas, numbness to around that area. So this is why we want to get the bigger. Last time we used a special small needle. Now we have to use the TrueCut biopsy because we want to get the hormonal type. So we wanted to know the subtype of breast cancer. Okay. Okay. Selepas, what do we do next after we get the biopsy? After we confirm the patient has the biopsy, then we will do the scan, CT scan, mainly to check whether there are any involvement of other organs, like usually whether it is spread to the liver or lung. This is where we do next after confirm it's cancer. Then after that, we will discuss with the patient whether the patient needs surgery or chemo first. Okay, this is where we get, okay, whether you want to do surgery first or whether you want to chemo. They are based on the hormonal type gained from the biopsy. Okay, basically these are the stages for breast cancer. If stage 1, it's only confined to the breast. Stage 2, it goes to the axilla. Okay, stage 3, it is more than the axilla lymph node. And stage 4 is the one that advanced metastatic disease. Okay, so usually bila kita dah tahu this is operable breast cancer, if we already find out this is the breast cancer that can be removed, we will offer 2 types of surgery, whether we only remove part of the breast, we don't need to remove the whole breast, or we have to remove the whole breast, and sometimes in young patients, we may offer them for reconstruction. Means that I will just explain later on. Okay. Okay. I just want to give examples. This is the real scenario of the patient, so that to make you understand. Okay, so the patients usually come in different presentation, whether they are in early stage or whether they are in later stage. Okay, for example, this for case 1, okay, it's a real life that came to us. Okay, these are 43 years old. Okay, she came for screening, mammogram, and ultrasound. She doesn't have lump. It's just when you know that more than 40 years old, they just go for screening. Dia tak ada lump. She doesn't have any breast lump, right? So when they did the mammogram and ultrasound noted screening, they found the lesion on the right side, but they don't feel any lump. Okay, so this is type of that where we encourage patients to come. Right, we want them to screen the mammogram ultrasound. We want to detect any signs of cancer before it gets palpable. Okay, so what do we do next? So we will ask the imaging guided biopsy. Okay, now the patient had cancer from the mammogram and ultrasound. So what are the type of the surgery we would like to offer to them? Okay, in this type of patients, we cannot, we have to have something to guide us where to locate us, where do we do the surgery. Okay, this is the type of surgery we call is hook wire localization by imaging. Maksudnya, we will send the patient to the radiologist, and then they will perform the image and then where's the location of the lesion, and they put the wire in, and then we can excise. So this is a very minimal surgery. Maksudnya it can be done kalau in private, it can be done as a daycare where you can come at the morning and you can discharge you by evening. It's the same day. And then for the axilla, we will do the sentinel lymph node. Previously, all the breast cancer, we have to remove the lymph nodes in the axilla. But right now, in the recent recent treatment, we don't have to remove the axilla. Of course, the morbidity from the axilla surgery is reduced, muchly reduced. We can perform sentinel lymph node, which we only take out about 3 to 4 lymph nodes. Okay, so that's the first case. The second case, okay, 50 years old lady presented with 2 centimeter lump at the right breast. Okay, it's still considered early. Less than 2 centimeter considered early breast cancer. So mammogram ultrasound noted suspicious lesion. So we take up the biopsy and it is confirmed it is cancerous. So what do we do next? Okay, so these are options that we can do. We can do breast conserving surgery. Okay, we can perform removal of the lump itself without removing the whole breast. But again, we still depend on the size of the tumor and the breast size. Even in the small tumor, okay, I mean in the breast, in the small breast, tapi the tumor is quite big, so we cannot perform breast conserving surgery. So this example that we have produced, okay, so this is a tumor which about 3 to 4 centimeter, right? So we excise the breast cancer, okay, so we can perform the white local with racket tennis incision. It's a part of oncoplastic treatment. So you can see your breast contour is still there. We don't have to remove the whole breast. Okay, so this is another lesion of the breast where it is located at the nipple. Previously, dulu cakap if it involves the nipple, you have to remove the whole breast. But right now, we don't have to remove the whole breast. We can perform the grissotive flap. Okay, as you can see, this is the example of the grissotive flap. So this post-op 6 months. Okay, the patient looks like the breast, macam the contour is still there. Okay, so if you come early to us, we have more options to offer you rather than you come in later stage. Okay, So this is another one, the round block technique, for example, oncoplastic, where we move the lesion is around the areola, around the nipple. Okay, it's about 2 to 3 centimeter. So we can, this is the type of surgery we will do. As you can see, if around that area, the incision and the scar is around the nipple. So we don't mean like it's just like we can preserve the breast. Okay, so these are post-op 6 months. Okay. Here's another patient of example of what we do in SGH recently. This patient said she refused for removing her breast. She only wants us to remove that part. Okay, so we, after explaining the risk, yes, we can, but what we do is we take a flap. Okay, this because after removing that big cavity, they will leaving a big hole. So we will replace with the normal breast tissue surrounding fat to replace the hole in the breast. Okay, so for example, this is post-op 6 months. Okay, you can see the scar is below the armpit. Okay, this is the, if you can see the right side of the breast, it looks normal, but it's actually, there's a lesion, cancer lesion that has been removed. Okay, so there are various of oncoplastic surgery that we offered to you. But again, if you come at early stage, more options can be offered to you. Okay, this is the case 3. This is the real life, okay? 44 years old, a staff nurse, husband is a medical assistant. Okay, came to us, presented with 2 centimeter breast lump. So we take the biopsy, memang confirmed as breast cancer. So we offered the breast conserving surgery, but patient refused. She opted for traditional medication. She said that she wanted to try other things. So say, okay, fine, we respect her decision, but a bit upset. So 3 months later on, she came with 6 centimeter breast lump. So, you know, at first we can offer the breast, we can preserve her breast. Now we can't. So we have to remove the mastectomy. We have to remove the whole breast. So this is a mastectomy scar. Okay, so this is the latest, based on the latest treatment. Okay, case 4, right? She's a 28 years old, presented with 7 centimeter breast lump. Okay, biopsy imaging confirmed cancer. She's a hormonal negative. So as what I have mentioned earlier, those hormonal negative, they respond well to chemotherapy. Okay, so we gave her chemotherapy to shrink the breast tumor. So before the tumor is gone, we will insert the breast marker. So that helps us to localize where the lesion before we excise. So after complete 4 cycles chemo, we have given, you know, chemotherapy to her. So the tumor completely responds. So we cannot feel any more lump. So next one, we proceed with surgery. So this is what the marker is, okay, after given completed marker, while the second cycle chemo. So we ask the radiology to insert the marker to us, for us, okay. Then after that, before the surgery, this is initial lesion. It's a big, huge lesion, okay. Then they put pre-op, they will put the hook wire to locate where the marker for us, okay. Where's the marker? Then after that, initially it was huge tumor. Now it's actually completely gone. We cannot palpate any more tumor. So instead of performing the whole mastectomy, we can live with the white local excision. So this is the last one, case 5. Okay. After 1 year, initially 30 centimeter. After 1 year, then baru they decided to see us. So increase in size, fungating, bleeding, smelly. They can keep this for 1 year. Okay, and it's very common. If you can see these patients, okay, these patients no longer seen in any of developed country. It's only happened at our area. Okay, they don't see any more advanced disease in developed country because they have a very good screening program. Okay, so these are for locally advanced, for young inoperable tumor. Usually, definitely, we will give chemotherapy to patients so that it will help us to do surgery. So the patient had done chemotherapy. So of course, the skin has to be removed. So we don't have much option. So we need to take LD latissimus dorsi flap, means we have to take the flap from the back, we have to take the muscle from behind and or muscle from our abdomen. So as you can see, right, the whole 5 cases that presented to us are presented with different stages. So the earlier you come to us, the more options we can offer. But the latest stage that we come to us, it is more difficult for us to treat. Okay, so the breast surgery is evolving. It's not like, okay, when you come to see us, when we diagnose with breast cancer, it's not a death sentence. It's a curable, almost 100% if it is treated early. That's why I'm telling my patient, you just come and say, just complete the treatment. Okay, every treatment has different role. It's not like last time when you've diagnosed with breast cancer, oh, I'm going to die. No, it's not. It's because it is very treatable if you detect early. Okay, so in 18th century last time, when you diagnose of breast cancer, they will remove the whole breast, the chest wall. It is very radical. Okay, then towards the recent years, okay, in 1970s, they start to have a lot of studies showed that if you do conserving surgery, but plus radiotherapy, it equals to the mastectomy punya outcome. Means that even though you do remove only the part of the breast and then you give radiotherapy, okay, plus mastectomy, the recurrent rate is about the same. So in 1990s, they do the study, okay? Okay, last time memang all the axilla you have to remove the axillary lymph nodes. But the study when they do, in early breast cancer, you don't need to do this axillary clearance because none of the cancers involved in your axilla. So we can perform lesser now. So lesser is better, all right? And then after that, a lot of chemotherapy have been produced, okay, to reduce the recurrent rate. So when we are treating the breast cancer, we are not only treating the breast cancer itself. Okay, kita nak treat only that particular time. We want to have patients less recurrent in 5 years. That's why we have a very good chemotherapy. Okay, then after that, reconstructive. In 2000s, they have developing all methods how to replace the breast, okay, or with reconstruction. Okay, so this example, axillary surgery, we need that for your thing, for your staging. Either you remove the axillary clearance, and this is the other one, that sentinel lymph node that have been mentioned. Okay, so 2 types of surgery that usually we offer, oncoplastic and reconstructive. Oncoplastic maksudnya we only remove the parts and then we replace the volume with other surrounding tissue so that you can have acceptable, asymmetrical, as much asymmetrical as the other breast. And this another one, reconstructive surgery, is autologous or implant. Maksudnya we just take our own muscle. Okay, you have this one, you remove the whole breast, but we will replace it with those autologous or implant. So these are the example of oncoplastic. I think they have shown the pictures earlier on. Okay, this is the reconstructive. Okay, we can put the implants in. Sometimes the implant, if we don't have enough volume, we have to top up with the muscles surrounding, macam ambil flap daripada abdomen or flap from the back. Okay, so this, if you can see, we want to maintain the contour. So these are the offer that we can offer to patients. Okay, so the patient will ask you, after the surgery, what do we do? Okay, there are a few things that we will advise the patient. The important thing about the post-op care, okay, we have to tell the patient that you have to start moving your hand because we don't want them to restrict the hand. Okay, so there are examples that we will give the ball sometimes. Kalau ada stok, kita bagi balls to patient and we advise them to move the hand. Okay, so adjuvant treatment means that what do you do next after the surgery? Okay, as is either neoadjuvant atau adjuvant. Neoadjuvant maksudnya chemo sebelum surgery, before surgery. Adjuvant is a treatment after surgery. And patient may ask, why do I need to get chemo? Why do I need to get hormonal? Why do I get radiotherapy? So I always tell them that these have different roles, okay? Surgery, I can only remove what I can see from my naked eyes, okay? Chemotherapy, function here is to kill the cancer cells in your bloodstream. So it doesn't go to the other organs, because we can see lump, okay, in your breast, tapi whatever the cancer cells in your bloodstream, we can't see them. Okay, that is why the chemotherapy helps. Okay, hormonal therapy is the one that therapy is for young hormone positive. Okay, we want to reduce recurrent of the breast cancer. And radiotherapy is the kill the cancer cells which around that area, especially for if the tumor is big, you have banyak lymph nodes involvement, or we do partial or only white local excision. So we want to kill the cancer cells that we can't see from the naked eyes. So that's why I always tell them, you cannot have 50% treatment. You have to have a complete treatment, because if you miss one of the treatment, there will always be risk of recurrence. So we do not want, we want have to have a patient free cancers for the rest of her life. Okay. So what's next after you have the follow-up? Okay, you always ensure the patient will undergo the proposed treatment. Okay, we provide counseling and moral support. We have, in my clinic in SGH, we have a good counseling. I have a counselor. We always make sure the patient will undergo the treatment. If patient have financial problem, we will try to sort it out to help them as long as they come to us. Okay, and then to detect any tumor recurrence or mets, maksudnya we will do yearly mammogram and ultrasound to rule out whether there's any recurrent, okay? And to control side effects of the after the surgery and the chemotherapy or radiotherapy itself. Okay, so usually we recommend the patients 3 monthly for the first year, 6 monthly for 5 years, or annual review thereafter. This is the usually mammogram, and ultrasound should be done by all patients with breast cancer. So what's the problem and aim for why do we all do awareness all the time? Because this is the one that we wanted to aim. Okay, we want to reduce the stage 3 and stage 4. Okay, you can see it's 25 to 22%. We want to bring out the stage 1. Stage 1 sekarang ni is still 17%. Okay, it's not like, that's why if you have patient with stage 1, early breast cancer, it's almost 100% curable. If you can see, the breast cancer, unlike colon cancer, unlike other pancreatic cancer, okay, this colon cancer, pancreatic cancer, gastric cancer, other things, it's inside your body. You cannot, it's usually they're presented with later stage. You cannot see, okay? But breast cancer is external, it's outside, which you can feel and palpate, okay? I always see the patient, I ask the patient, how do you detect the breast lump? Oh, my massage lady detected the lump for me. Have you ever examined yourself before? No, I never examined myself. So this is the example that we always want to emphasize. Self breast examination is a part of your routine monthly examination. Okay, it's not like waiting for your massage lady to examine you. Okay, you have to examine yourself. And then screening mammogram is very important, for more than patients with 40 years old, because when we ask, you know, there are certain NGOs or certain government subsidized company like LPPKN, they offered the program, okay, 200 patients free subsidized for mammogram. But when we asked, they said that only berapa percent, and they have a lot of slots for mammogram, free mammogram and free mammogram screening, okay? So we don't want you to come in this stage, okay? We want you to come early. If this stage is very difficult for us to treat anymore, okay? Right, these patients still come to see us, okay? So it's besides us, we have a lot of NGOs that come and volunteer to help out to reach awareness among the public. Okay, we have peer support groups. Okay, every year we will do public awareness, provide information, educate and the public. We will provide counseling. If you have any problem, any questions, there will always be breast cancer survivors around you. Okay, that is why one of the SCAN is very actively educating the patient and awareness. We have Pink Ribbon support group, we have breast cancer support group. There are a lot of NGOs outside there. Okay, so we have a lot of activities. Politicians also have been helping us and contributing and giving us the support. Okay. All right. We have yearly breast examination almost every year, but except for last year, we invited public. We went to University, we went to Boulevard. So we give the brochure and invited them to come to hospital so that we can examine them. Okay. So role of screening, of course, early detection save life. Okay. Then we allow you to do the screen. We encourage you to do screening mammogram if you're above 50 years old, but if you have symptom of breast risk of cancer, then you do earlier at 40 years old. Okay, so this example you wanted to get, once you get the mammogram, we can detect carcinoma in situ, the one that I have mentioned earlier. It occurs in the dark. Okay, it only it has not been invaded, it's still within the wall. So this is not developed cancer yet. Okay, so we wanted to detect your face in carcinoma in situ. Okay, so when to do breast self-examination? Every month you have to do. It's between 7 to 10 days of the onset of your period. Irregular period or no period, okay, do it on fixed date every month. Put in your Google Calendar. So when to examine your breast lump, okay, first day of last day of the month. So these methods, usually what you do, you just stand up on a mirror, arm at your side, you raise above or arms behind the head. Okay, put your hands both hips and chest muscle, and then you palpate your breast. Always tell the patient that the best person to examine the breast is yourself, because you can tell the difference every month when you examine. Okay. Okay, be obsessed to yourself. Look at the mirror. How's your breast look like? Any asymmetrical, you can come to us early. Okay, this example, you use the 3 fingers on your left hand, right or left. Okay, just make sure that you don't miss any part of your breast. Okay, this is another example. You can do circular motion as long as you don't miss any parts. You can use the vertical strip. You can use the circular method. Okay, you can do it during your shower. And the most important message before I leave, okay, breast cancer is curable with survival rate almost 100% if detected and treated early. So if you can come earlier to us, we can perform the breast conserving surgery, and we can avoid the extensive treatment for you.
Thank you, everyone. Thank you, Dr. Adibah, for the very valuable talk. I think you covered a lot of things that many people would just put away as like simple signs, and that's why mungkin kadang-kadang dia tinggal sampai di belakang lah, because it's too late to come back to the for the diagnosis. I'm Fitri, by the way. I'm sorry, I forgot to introduce my name. I'm Fitri. I'm lecturing in UNIMAS, and I'm also a breast cancer survivor. And Dr. Adibah is also part of my treatment program. And Alhamdulillah, everything has gone quite well. The question that we have from Dr. Kiki Win is, what are the indications and complications of breast implants?
Okay. Okay. When we see the patient, there's a potential of we can perform the implant to them. Usually, we will look a lot of things that we need to consider: whether the size is suitable, whether the patient stage of breast cancer. Let's say most of the patients that we offered are those yang early breast cancer, let's say DCIS, okay, or early breast cancer, but they have the multifocal disease. Okay, we have to rule out they are not stage 3, stage 4. Last time, yes, we do have immediate and delayed implant, but we have to tell them that if they have to undergo the radiotherapy, they can have long-term contracture of the implant. But again, when I tell them these are implants, it's not like autologous. If you have complication of implant, there's always be risk of we can remove it. Okay, they don't lose anything. They just, implant is expensive. It's about 2,000 something, and patient has to purchase. All right. We don't have the program yet where we can subsidized patient with implants. So I have to tell them contracture, long-term contracture is one of the complications. Infection is also complication. Implant rupture, maksudnya the implant can be leaked out. Okay, and then the other thing is bleeding, right? But then so far what we can see, usually because maybe the law of implants are still low at our center, so the common symptoms they said is mainly the size dia tak compatible, and it's not comparable sangat lah. But then usually we will combine with the plastic team as well, so that they can perform sama dengan kita, so that we want to have better cosmetic outcome.
Right.
Yeah.
There's a question here about biological targeted therapy, doctor. Do you know about it?
Is this a targeted therapy?
Yeah, targeted therapy. Maybe you want to explain a little bit?
Okay, targeted therapy is it's not chemotherapy. Chemotherapy is more like systemic. Okay, when they target systemic chemo, it goes to the bloodstream. Okay, prevent the cancer to spread to other side. Targeted therapy, it is directly target to the tumor itself. Okay, but the study showed that the targeted therapy is only useful for those who have metastatic disease. Maksudnya those yang stage 4 disease. So they have studied when they put this targeted therapy to other breast cancer yang bukan stage 4. It does not give any sama, survival rate is the same, but it is expensive. So they can only say that it gives a very good effect kalau they are stage 4 disease. So it's very selective to certain patients.
Right. There's actually a request here from Cindy. I'm not too sure which Cindy this is, but she asked if we can organize a breast screening in UNIMAS. I think we're planning to do that.
Yes,
anyway.
actually, I approached Dr. Fitri. I said that we are interested now. We are interested to get a target population rather than the big audience. So we wanted to go to every center so that we can examine. So there is actually part of our plans. Tapi because of the COVID pandemic, this time we have to postpone the plan first, because what I can see, those professionals, they tend to come later. I don't know whether they are in denial, and then they have more better financial support. They can look around, they can Google, they have internet to look out. So those who actually come later to us are actually those are professionals. UNIMAS staff they are I think ramai juga yang UNIMAS, among UNIMAS staff, they're afraid to come in and came to us at later stage.
Right.
Okay.
Yeah, thank you so much. I think we will try to organize a session where what do you call it? We're going to have the nurses and doctors from SGH to come and do a proper breast screening examination for people who are interested to do it. We are thinking of at the end of February or March with the UNIMAS clinic support as well, because I think it's a bit more comfortable in our clinic. The clinic's quite huge, and we have the facilities as well, and we have doctors there as well. So let us get ourselves coordinated. Right now, I guess as you know, we are all diminta untuk mengurangkan movement kan, jadi with all the darurat that just came out this morning. So it's a bit confusing, like how we're going to arrange for get-togethers in events such as this, although it is quite important. So let us coordinate, and then we will let you know through PPAU. PPAU will make the announcement on campus. And then those of you who are interested to do the breast screening, I think take the opportunity the minute you hear about it, sign up, and then find out. Yeah. So yeah. Ada lagi nak tambah tak?
I think I hope really macam this kind of activity, it doesn't occur only in October. It has to be throughout the year. So from our side, we would like to support if you would like to know more, you can always approach one of us. We will try to organize some education and part like macam online, this kind of online meeting, it is very useful. Yeah.
That's right. Is there anyone else who would like to post questions either in the chat or you can unmute yourself. You can ask us questions here while Dr. Adibah is still with us. Maybe we just give a few minutes for you to think up a question. I think it's nice to have your answers quite directly while she's here. While we're waiting for them, Dr. Adibah, do you find that people are still macam maybe malu kot nak nak tanya? I think it's a big deal for women up to now. Maybe nak tanya, it's the breast is a very personal area for I think all women kan. Jadi when there's something wrong, mungkin macam mana kita nak elevate fear tu?
Yeah, that's why macam for us, sometimes they afraid to come and see us. That's why I always tell the NGOs, when you all have the survivors, okay, sometimes the patients, they are more comfortable to talk to the survivors because they experience. They can talk to us, but how we feel are not the same like the survivors. So that's why I always tell them, the NGOs, okay, and if I see a patient, I always recommend them to talk to you all.
Apa lagi? Is there any other questions, guys? I have a whole team of research here actually at the Game Lab.
I think what's the culture? Is there a culture taboo still for women and breast? And
banyak
as well, I guess.
Ada, but then we try to tell them that okay, if they believe in something, okay, we don't stop you from believing things, but you try not to, try to combine with our modern medicine, okay, not to leave that whatever belief behind and then leaving and then leave our modern medicine. Sometimes, for example, sometimes they believe, okay, my few patients, they cakap, I'm afraid to do the biopsy because I'm afraid that the biopsy itself can cause seedlings. Then I've told them that there's no reason, the study showed that the biopsy itself can cause seedlings. Okay, so without the biopsy, we cannot proceed more. We need to get the diagnosis.
Kadang-kadang itulah bila kita dapat misinformation kan, and then we act on it, and then tak dapat information yang sepatutnya dapat daripada medical professionals like you. This is where kadang-kadang yang datang lambat ke hospital tu. Yeah. So yes.
I'd like to say something.
You have a question?
It's not a question. All right. Assalamualaikum warahmatullahi wabarakatuh, especially to warga UNIMAS. Actually, I just would like to say a few words. When I was then diagnosed with breast cancer, I remember like everybody was going for their mammogram. Then after that, when I left, I don't know what happened. And unfortunately, I've even met a lot of even pensyarah, professor yang has gone through cancer at a very late stage. I would like to tell everybody that I'm still here. I might not be the VC's wife, but I'm still who I am. I'm approachable. You can ask Fitri, you can ask a lot of others, UNIMAS staff, that being a survivor, I have volunteered with the helpline. So if you have anything that, if you think you don't know so much, segan nak cakap dengan Dr. Adibah or anybody else, I'm always here to help you out. In fact, hold your hand and even bring you to see the doctor.
Yes, Datin selalu bawa ramai patient.
I bring all kinds to Dr. Adibah, not only Dr. Adibah, even cancer lain yang which is not involved with me, but I just be there to be with them, to just give them a moral support. So I'm still here. I'm still who I am, and ever ready, able to help whoever in need, especially with cancer. That's all I have to say. Yeah.
Thank you. Thank you very much, Datin.
Dekat breast clinic SGH, we have 3 surgeons. All are female, so I don't think that you can be malu to us. We have another breast endocrine surgeon and a very senior surgeon, Miss Rokaya. I think those survivors may know her, Miss Rokaya and Miss Ashwina. So 3 of us have running the clinic with the assistance of my team. And then it's a very good setup. I think macam Datin or Fitri and other Dr. Fitri and other survivors have went to clinic. It's a very pink, cozy clinic. Okay. And then kita punya staff nurses are very well trained and they also try to catch those defaulter. Okay, those yang macam tak nak halfway giving treatment, we will try to call them. And if you have any assistance financially, we will try to divert them to any support. Basically, I would like to tell that we have a very good support team. Yeah.
I think your nurses are also very kind.
They are very, they're very helpful.
Yeah, very helpful. And I think they go out of their way to,
Yep.
to check whether, you're all right or not.
Yep.
What are the things that you're confused with,
Yep.
So yeah, very good team you have. Okay, do we have any more questions? None so far. Can we switch to Mrs. Siu Boon Lui, actually, Miss Siu Boon Lui. She's the president of SCAN, and she has a couple things to say to introduce you to what SCAN does.
Dr. Fitri, can you hear me? First of all, thank you for having me here, giving me a few minutes to say something. My name is Boon Lui. I am the president of SCAN, in which Dr. Adibah, the speaker this afternoon, is also one of our medical advisors. Dr. Fitri is our committee member, and also Datin, who has just shared a few words, is also our advisor. So I think it's a very much a privilege for us to share with you guys about the importance of knowledge about cancer, and especially breast cancer, particularly this afternoon. And we believe that knowledge is power. So getting the right information will help us to alleviate fear, and getting the right information from the right source. The right source is our doctors and also the reliable website. And I just want to share that I myself is a metastatic breast cancer patient. And I always like to refer to myself as a breast cancer survivor because I've survived breast cancer since 2006, 14 years. Been through mastectomy, chemotherapy, radiotherapy, palliative radiotherapy, and now I'm put on targeted therapy via oral medication using one of the targeted therapy drugs. And I'm very thankful that I'm able to speak here because I know that many cases, the survival rate vary from one person to another, one case to another. As my inspiration here is that through SCAN, our little cancer NGO, we will be able to become the voice for cancer patients. We'll help alleviate all the issues that require attention by our authority concerned, as well as at the same time to do as much education as possible to the people in our community, including our educational institution like UNIMAS. So, and also I'd like to emphasize that we have two afternoon every week. We have a helpline available for anyone who would like to share their inquiries or worries or concern, even if you have friends or family members affected by cancer. It can be other cancers besides breast cancer. We try our best to lend you our listening ears and help you to find ways and means to overcome your challenges along the cancer journey, or helping you to support your someone close to you who have cancer. Yeah, so that is about helpline. And on the other hand, I'd just like to emphasize that we have actually published a book, a cancer guidebook, to help cancer patients along the cancer journey, which is, we know, is difficult. So this is a book that we have. So you have Cancer, What Now? And we have actually published the Malay version and also the Chinese version recently. So feel free to contact us and we can liaise with you separately how to get to you a copy of this book. Yeah, I think that's about it. Dr. Fitri?
Yeah, thank you, Boon Lui. There's a question actually, which I think you should be answering, Boon Lui.
Oh,
Just a minute, yeah.
oh,
Okay,
should
how
I
to
read
stay
down the question
positive
itself?
when
Oh,
the
yeah.
patient is diagnosed with stage 4? I think you're the best person to answer this, Boon Lui.
Yeah. I think first of all, being a cancer patient who have been through the first diagnosis 11 years ago, before I was diagnosed the second time with a relapse, I will always tell myself, I'm my own senior. I've been through that road, right? So now here comes another blow. But since I've gone through the first challenge, this is just the second life storm, and just face it. So that's how I tell myself. And I also tell myself to be grateful for all the years God has granted me, 11 years before relapse happened. That also shows that the past treatments, either it's chemo, radio, or oral hormonal medication, actually has sustained me for more than 10 years before the relapse happened. So that's how I look at things this way. And also knowing, after discussion with doctors and all the consultation, knowing that there are a lot of trials, critical trials, as well as approved targeted therapy drugs that's actually suitable for my subtype of breast cancer. So I was happy to make the arrangement with my doctor to get going. So and most importantly is that no one actually knows how long our life is going to be, right? Whether you have cancer, you don't have cancer, we do not know when is the last day we have on earth. So what is most important is for us to seize the day. Whatever we can do now, let's do it now. Things that is meaningful, close to your heart, do it. So I choose to invest my time in this cancer NGO, taking the time working with the team here to publicize and to educate and to share our stories, hoping to encourage more people to face cancer journey with courage. And the more we help people, the more meaningful I think our life can be, regardless of the length that God is going to give me. Yeah, that's how I look at my life now. I hope that helps.
Yes, very much. Thank you. I think there's a question about how to get the book. Yeah, I think we need to show the cancer
Yeah, we have a slide on that.
Facebook or email address that people can get in touch with us.
You can actually leave message to our helpline. If Chris is here, Chris can type out the helpline number in the chat box.
If you're in UNIMAS, you can actually get in touch with me because I have a few copies with me as well.
Yeah, Chris has sent out in the chat box there our number, our helpline number. Can leave a message there because behind the number is a handphone number.
Any more questions for Dr. Adibah? So far tak ada kot.
Really hope it's loud and clear.
Yeah, I guess so. It was quite interesting, and also the pictures help as well. It gives it, I think it tells a story on its own, kan?
Yeah.
The slide that you showed us, because it's actually a person behind all the pictures.
Yeah, I prefer to have a case scenarios, but people like to hear stories rather than facts much. Yeah.
That's right. That's right. Okay. I think we will close here. Yeah. I think we'll.
Can I
So
say
those
a
of
few
you who
things
are-
first?
Oh, that thing was to say
Hello.
something.
Yeah. I know a lot of people are kind of find it difficult to talk in a group like this. Like I said, we are here to help. Please do come out. I really do not want to see a lot of friends go. Over last year, for example, we have lost Dr. Nosia, who came to see, when when I went over with Fitri, it was so late, you know. I felt that in an institution of higher learning like UNIMAS, we should not be finding people who has come to so late before it's brought into our attention. So jangan tunggu dah teruk-teruk. Rasa sikit, please look for us. We are not doctors, but like I said, I'll hold your hand to see a doctor. And I've lost a very dear friend also in fashion, also in UNIMAS. So I think it's very sad that we're losing people like this when we actually can go for early diagnose. So do come forward. Okay, in a group like this, memanglah kadang-kadang orang tak sanggup nak cakap. But as you know, we have the helpline, or you can directly get in touch with us. I keep saying that, talk to us, please. Don't wait. Yeah, anything. I don't know whether a lot of you ingat dengan Robert Malung, for example. He was at Sebayu. He used to be 110. By the time I saw him, he was only 38 kilo. So, I mean, these are all late stage cancer. And I don't want to see any of you like that. So please come early. Talk to us. Thank you. That's all I want to say. Yeah.
Yeah, and we have one more question, Dr. Adibah, for you. Nak tanya kesan pengambilan ubat hormon tamoxifen.
Oh,
Yeah, do you
okay.
know side effects of
Yes,
Yeah.
tamoxifen itself dia because it's a hormone, so of course dia ada side effect yang macam dia function of tamoxifen dia menyebabkan you menopause awal from the age. So of course the symptoms that produced by tamoxifen is similar to those yang menopause. Contohnya osteoporosis. Okay, you have exactly lah macam yang ada menopausal symptoms. That's the side effect.
Yeah.
But then those patients yang young age, you may not to allow to get pregnant while you're on tamoxifen. Tapi there's again young patient, kita orang ada banyak option to them. Okay, like we have the fertility clinic, we can simpan you punya ovum while you're having the treatment. But there always be a discussion between us.
Right.
Yeah.
Right. I actually got stopped by one of patient, tak tahu siapa punya ni lah patient, tapi when I was collecting my tamoxifen last month, and then she said, how long have you been taking this? This tamoxifen is making me itch the whole body.
Yeah.
So I think it differs from one patient to
Yes,
another.
yes,
Kan?
yes.
So she actually stopped taking it because dia rasa macam tak comfortable. She cannot go on with her daily activities.
Yes, tapi dia ada option lain. Tamoxifen is not the only hormonal treatment available.
Right.
That's why if you some patients have very bad side effects. Not everyone have the same. So you always can discuss with the oncologist, and they will give you some other forms of hormonal replacement besides tamoxifen.
Right. Interesting. Bulu also has experience with tamoxifen. You want to talk about it?
Just a very quick one. Mine was basically the irregular menses that I experienced. Other than that, it was all fine. I took 5 years. Yeah.
5 years, yeah?
Yeah.
No side effects, no major side effects.
Very mild until I think I cannot remember.
Thank you, Bulu.
You're welcome.
Okay, I think we are going to close this now. Thank you so much to Dr. Adibah for coming all the way to UNIMAS. We actually brought her to UNIMAS today.
Yeah, thank you to you all.
I hope you're okay with the setup and everything. We have this little studio set up because in anticipation that we would not be able to have face-to-face workshop because of COVID. So that's why the studio is set up in this way.
Yep.
And we're going to have the recording of the session available for you. So we will let you know how to get in touch and how to get a copy of the recording. And we are not able to share the slides though. There were some questions about asking whether we could share the slides. I think we can't do that. because there's some patient information in the slides as well. So what you've seen in the recording would be, I think, would be enough.
Yeah.
Thank you to all of you who I think we had more than about 60 people today this afternoon. So thank you so much.
Yeah, Alhamdulillah.
Alhamdulillah. And please stay tuned. PPAU has a lot more activities coming on this whole year. And we are very much looking forward to your participation. And thank you again, Dr. Azani, for mooting this, this whole session and to have this very important talk. And we are very much supportive of, the welfare of especially female academics. And this is a very difficult topic to talk about. So yeah, we start January with a very difficult topic. So anyhow, take care everyone. Stay safe, and we hope to see you again soon. Assalamualaikum warahmatullahi wabarakatuh.